So now we're going to talk about the quality assurance in our work for the upper wax rim. Once we receive the wax rim from you, we are looking for the following features. We need to make sure that the measurement anteriorly is 3 to 5 millimeters. The measurements in the canine area, 5 to 7 millimeters. In the molar area, 8 to 10 millimeters. 8 to 10 millimeters in the molar area. We also need to make sure that we have a bevel posteriorly. So the wax meets with the tuberosity. The total tuberosity is clear, and the wax meets posteriorly in a bevel. This will allow clearance for the lower wax rims when they come in contact with the while mounting. We will re-emphasize this point later on. So we have a bevel at the posterior end. If I take a measurement using the ruler from the central of the ridge on the flange area, in the lateral incisor area, we'll have around 22 millimeters height. Okay, 20 millimeters height. And we prefer that this empty space, do you see this empty space here in between? Now we're going to talk about the final features of your submitted base plates and wax rims. So once we finalize our work, we need to find that the upper are placed, wax rims are placed slightly to the buccal, and from the canine to canine area, they are placed slightly labial. So you have what we call labial inclination. This one is one of the properties of anterior teeth. Posteriorly, the wax rim should have a beveled shape and have the tuberosities clear. So if we have any wax located over the tuberosities, we clear it, and we further make a bevel. This is to allow clearance with the lower, so the lower heels will not interfere with this wax while mounting. Another feature is that the occlusal table is totally flat. And if I take a cross section here, I find that the angles are still sharp and clear for the wax rims. Once we finalize it and smooth it, we are ready to go to the second step. So if I take a good look vertically over this, we will find a thin margin of blue material showing on the buccal and labial surfaces, meaning that although we went with the wax rim more to the buccal and labial in the upper, we have not exceeded the sulcus depth of the cast. For the lower, once we finalize our work, we want to make sure that the wax rim orientation is parallel to the floor, and the posterior extension of the height of the wax rim is over the line of the half of the retromolar pad area. The height of it anteriorly, if I want to measure it, it's around 18 millimeters from the depth of the labial sulcus, from the depth of the labial frenum in the labial sulcus in the midline area, up to the upper part of the wax rim, it's around 18 millimeters. And other measurements that apply for both is that the anterior area 5 to 3 millimeters width, premolar area 5 to 7, and the molar area should be around 8 to 1 millimeters wide. So this is the upper range and this is the lower range of the measurements. So these measurements are all present, and then once we place them on cast, once we have the cast ready, they are flat, the occlusal surfaces are flat, and they meet each other in a neat plane all around. So now we're ready to do what we call mounting. Now we're going to do the step where we're going to do mounting. Mounting is the step where we attach the upper and lower casts to the articulator in a manner resembling the patient's measurements. Because this is the lab part of the procedure, we don't have a patient, so we're going to use what we call arbitrary mounting, not based on patient measurements of face bow record and retrograde contact position. You will take those subjects later on in the jaw registration lecture. Arbitrary mounting means we are using a wax rim and base plate that have been done according to average measurements. Once this finalized wax rim is ready, we want to attach it to the articulator in a method where it is the clusal table of this is parallel to the floor, and the cast itself is not hitting with the upper member of the articulator. So to do this, we're going to mount the upper first. We're going to use what we call a mounting jig. This comes with the articulator itself. So for us to identify your work, once we mount this surface will be removed. So make sure that you write your name and information, which are the seat numbers, the details, all of these in the back end of the cast. And once we mount it, also add, please, a name tag attached here. So we want to begin, before mounting, to preparing this cast in a way that it's received by the articulator easily. First of all, we need to know where is the midline of the patient. For our lab casts, these casts are made in a way that the labial frenum is in the center of the center into the cast or residual ridge morphology. But in actual patient cases, sometimes the labial frenum can be traumatized and moved to one side or another for many reasons. So we use usually the best indicator of the midline, which is the incisive papilla. So if you draw the incisive papilla and the general outline of the mid-palatine raphe, we will have two structures to compare with, and these two structures are in line with the midline. So holding the ruler over these structures, we can vertically extend our vision onto the land area of the cast and draw a line, and this is now our midline of the cast. Once I place my wax rims back, now I have an external reference line to compare with, and simply I extend this line onto the wax rim. If I hold it perpendicular to the cast, this is my midline I have, and then I extend this line onto the wax beneath. So this is the midline. Second is that I need to center this cast over the middle of the jig area. So I center it using this notch. As you can see here, this notch should be corresponding with the midline here. And then I begin moving the cast back and forth until I have the cast material centered over the jig. So if you have a vertical view, if you can see the vertical view of this, you will find that the cast is centered to the left and the right, and the jig in the center over the jig. We also make sure that the pin is fixed to a position where the midline, the thick midline, is exactly on the edge of its entrance and then fixed with a pin. So the height of the pin is fixed in position and it touches the table. If the cast in any way was big or large and interfering with this insertion of the pin, we have to trim the cast a bit until the articulator closes smoothly without any interferences with the upper member. So the midline is there, the centering of the cast. I could also see it from posteriorly that the cast is centered. If you can look, have a look here. The distance of the cast to the side members is the same all around. And now we're ready to mount. So mounting is fixing the cast to the articulator. So what is the material we're going to use? The material for our selection today will be a plaster. Plaster is a material that will bind to the cast chemically, where crystallization begins from the cast, and it will bind to the articulator mechanically. So the articulator has what we call an upper ring. This is a ring that can be detached, but for the case of mounting, we keep it attached, and it has some locks and irregularities in which the plaster will go in and retain to it mechanically. And we can add some of the plaster a bit over just the margin of this articulator. So in preparation for the mounting, first of all, we take out the cast, take away the base plate, and just soak the art part of it. The art part is not the anatomical part. The art part is the part around the base. It's just for the purpose of design. So we're going to soak this side into the water. Try to avoid having the anatomical surface included in the soaking. For the articulator, we paint all of the members of the articulator using Vaseline, except the ring, because we want plaster adhering here. But we don't want plaster adhering on the sides of this, so we paint the articulator using Vaseline. Only a thin film of Vaseline is placed, avoiding the ring area where we need retention. Now the cast is soaked. The function of soaking the cast is that water will go into the crystals on the surface and partially dissolve them. When the new plaster comes and meets the old gypsum, this is stone, but they are all gypsum material. They have the same chemical composition almost. So once we have soaked these crystals, part of them have dissolved and became a bit soft. This soft crystal surface, with partly dissolved, will create a good nuclei of crystallization of the new plaster to it, and it will bind better to the surface. If you don't soak it, the plaster can easily break off the cast in later steps. Also, soaking it has softened the cast a bit, so we are now ready to do notches. The function of these notches that we created in the soft base are orientation notches. Later on in the procedure where we're doing dentures, we will have to take and separate the denture from the plaster mounting and then put it back and reorient it. So these help us, these indentations will be met by the plaster by positive indentations going in. So what if we take those two parts apart and put them back, we can easily reorient them. We'll see it in the final product. So we're going back with the wax rim in place, midline over the notch, centering the cast over the jig, closing this upper member, making sure the pin is fixed in location and it meets the incisal table of the articulator. We have clearance between the cast and the upper member, and now we're ready to do the mounting. Now once everything is ready, we make our mix. It's a mix of plaster, and it's a bit heavier than the mix we have made for the impressions. So once it's smooth, we add it to the cast immediately. So we open the upper member of the cast. We add it over the soaked cast that has been soaked previously. And this is why we told you, please write your names on the back of the cast, because the names that you have written on the base will disappear under the mounting material. Make sure that it's fixed into location. and we squeeze into place, making sure that it's still centered. Once we squeeze into location, we want to make sure that we have totally closed, so the incisal pin should meet the incisal table. So that's now correct. The table is meeting the pin, and now we begin with the cast is centered in the middle and centered around the upper member, and we begin using this consistency, which is a bit thick, as we told you, to carve away the plaster. We carve away the plaster, making sure it's connected from the cast to the ring only. Any excess is removed all around. Then once all excess is removed, you can use your wet fingers to further smoothen and remove excess and smoothen the mounting, making sure that the plaster went into the indentations we have carved in the cast. You can see how the plaster went and covered those indentations. We clean the cast from all sides and wait for it to set, ready for the lower mounting. And we could wipe away the excess plaster over the articulator member using a wet napkin. And now once it's set and we have cleaned all of the members, they are back to clean, we are able to open this securely. And now we have the upper member here. For mounting the lower, we are going to first take off our mounting jig. This is a removable part. There is a screw beneath your articulator where you can just unscrew it. And we're going to attach, instead of it, another ring that comes with the articulator. The ring will not go into position until these indentations go into the depressions that are opposite to them. So we make sure they fit into their depressions. Now we can secure the screw. And now we are ready to do the mounting of the lower. For the lower to be mounted, first we're going to invert the articulator. Now it's upside down. And we're going to place the lower according to measurements. So we are still using the average mounting. But if this was a patient case, we would have the upper and lower wax rims fixed from inside the patient's mouth. Inside the patient's mouth, after we adjust the upper wax rim and everything is okay, we add the lower end, let the patient bite with a sticky material in between, and this will hold it in place. But in our case, we don't have a patient, so we're going to put it in an average. So first of all, we take out the cast. We're using the wax rim only. We're trying to center the wax rim, the lower wax rim over the upper. And how do we verify it? If we look vertically here, we are looking that the base plate from the left and right is centered over the lower cast as well. So this is the lower base plate, and this is the upper cast already mounted on the articulator. We make sure it's not tilted to the left, not tilted to the right, not going back, not going too much further anteriorly. We only go back enough to have what we call an overjet, which is the distance between the central incisors of the upper and the central incisors of the lower. They're not in the same line. So we center it. So it's now centered. If you look vertically once more, centered. And also we make sure if we look from the side here, this side, you can see that the heel, what we call the heel, this is the base plate going over the retromolar pad area. Remember that the retromolar pad is going vertically. So its base plate will also go vertically. So we want to make sure that this heel area, which was over the retromolar pad, is not hitting the lower base, and it's clear from the wax. And this was the main function of the bevel we made here. We made it to make sure that this base plate going vertically does not hit over the wax. We want the base plate clear, and we want a free a totally intact surface between the lower wax rim and the upper by having both occlusal tables totally flat. So once it's centered, I'm using my vision here, vertical vision. I'm also looking at it from posteriorly. If you look at it from the posterior, you find that the ridge is centered over this. So it's centered and a bit more interior to make the overjet exactly 2 to 4 millimeters. And now this is ready to be mounted. But because it is a bit light and it can move around, we need to fix it into place, making sure that it will not move while we're placing the cast and mounting the procedure. So we use the sticky wax, we heat it on the flame, and we let it drip in between the two members. So if I'm looking from this side, after I have centered it, I use my sticky wax and let the sticky wax drip into place, fixing the upper and lower members together into location. In the case of a patient, we would have this fixed from the clinic. The upper and lower are fixed to what we call retruded contact position in the patient's mouth. But here we're going to fix it with a sticky wax. And now it's a bit firm in place. So once I'm going with the additional steps, I could easily put them. For the lower cast, we're going to repeat what we have done in the upper. I'm going to soak this part, the base of the cast. I'm going to do the notches, 1 interior, 2 in the posterior, and come back and put it into place and then begin mounting. I soaked the cast, the base of the cast, and I'm ready to do the notches. Just before doing the notches, I put the cast into place and make sure that there is no interference of the heel area of the cast with the upper. So there are no interferences from both sides. I also make sure that this can close over it. My reference is the incisal pin. Does it touch the table or not? For in my case, it's not touching. There is something interfering. So this base needs a bit of trimming before I begin the mounting procedure. After the trimming now, we notice that we will have the closing of the pin over the table correctly, and we have amount of space for the plaster to be placed between the ring and the cast. And we're going to do the mix for the mounting. Now, after soaking the base of the plate and placing the notches and making sure it's clear from the articulator, not hitting the member of the ring which is close to it, we add our plaster. So once more we add it on the base. We cover the base. We make sure we go into the notch areas. And we make it in a consistency that it is a bit firm. And then once we mount it over the cast, we squeeze the articulator over it. So we're going to close our articulator, and our clue that the articulator has closed, that the pin is on the table back. Okay, they fit. And now using the consistency, we could just wipe away the excess, making the cast and the ring in one line. So the cast is now continuous with the ring. Any excess going to the outside or bulging between the cast and the ring is removed. And once it's smooth, we're going to wet our fingers using some water and wipe away and smoothing the surfaces in between. If we have any deficiency, we could just add a bit and fill it in. We make sure the notches are filled in with plaster material, and then we While wiping away the excess, we compress the plaster to the cast once more, filling in the gaps. We repeat this all around, and this is the mounted cast ready for the setting of the teeth. We should not invert the articulator, unless the plaster has initially set, and that is around 10 to 15 minutes until it can withstand the inversion of the articulator. If we invert it now, what will happen that it will slump away from the cast and the cast will move in location. So we want to make sure to keep it upside down. The articulator is upside down up to the end of the setting of the plaster. And this is the work you're going to submit at the end of this lab. Thank you. You're going to go into the central lab by groups. Those that have approved upper and lower wax rims will go inside in groups of 6 students to do the mounting. And once they mount the upper alone, they come out and wait for it, then mount the lower.